Hey everyone, Steve Kermanek here again with Dr. Roach. We're doing another protocol minute. Every month when we meet, Dr. Roach has us look at our metrics, and the EMS captains are going to be getting this disseminated to them pretty soon so that they can give you guys some feedback on how you're performing. And one of the metrics that we measure every month is sepsis. And we talk about sepsis. You and I have been talking about sepsis for years now, and about how to get, whether or not we should, even think about deploying antibiotics at some point for scene management with antibiotics pre-hospital, or if we should just get everyone to focus on doing a good QSOFA, and the hospitals on board with understanding that when BSO calls a sepsis alert, it's not because the patient's 100 years old with a fever over 100.4, right? A sepsis alert in BSO means a QSOFA, positive QSOFA, which means they are in septic shock.
We definitely want to have the ability to recognize septic shock. That's really the key thing. We want to know, we don't want, SIRS criteria where, like you said, they have a fever and they're a little tachycardic. And then when you announce sepsis alert, you go to the hospital and the nurses and doctors are looking at you like, what's your problem? Because I got other people that are sicker than this. So we want to be able to say, as you stated, BSO saying septic shock, there's a sepsis alert, that's the real deal. These people have a high mortality rate and they're in dire situation. So we want to get them going. And then what we also want to do, and once the hospital is on board and we're kind of working together, integrated, EMS and hospital, we want to look at metrics on the hospital side, see how long it takes them to give the antibiotics. And if they can pull this off within 30 to 60 minutes, then I don't think there's a real need for the agency to carry antibiotics.
Right.
However, if it turns out that it's 3, 4, 5 hours to give antibiotics in the hospital side, then we're going to need to probably do it.
Right.
Yeah.
When you guys open the form, if you look at it, the top 4 questions, I believe, are QSOFA questions. First one is, do they have an end tidal of less than 25? Yes or no? That's the minimum qualification. So every septic shock patient, any shock patient really needs to get an end tidal CO2. But specifically when we're talking about sepsis, they need to get an end tidal CO2 of less than 25.
Yep.
They need to have hypotension, ultramental status, or tachypnea, right? So the reporting system will do your job for you if you just allow it, but you have to be heads up enough to be able to go in and actually fill out that form and do that. So we look at these metrics every month, and some of the things we look at is sepsis scene time. We want to be off scene in less than 15 minutes, right? Just like trauma, we've had that beat in our head that like you want to get off scene in less than 10 minutes. Same thing with sepsis. We want to be off scene in less than 15 minutes. Remember, they're in shock, whether it be hypovolemic shock or septic shock. They're in organ failure, right? So we want to get them off scene. Right now, last month, our goal is 50% of the time. Last month, we were at 49%, so you guys are doing great on that. Our scene time was an average of 15 minutes and 50 seconds. You can't get much better than that. Yeah. So you guys are kicking butt on that. We had 6 patients that had a positive QSOFA, and out of those 6 patients, 98% of them got an IV with a bolus. And that, I got to say, give credit to you guys for making sure you've been listening to our videos and listening to our EMS captain's feedback and everyone about getting an IV in place and getting fluid on board, right? That's huge. These people need a lot of fluid, and a lot of times, when they progress into this shock, they need push-dose epi.
Yeah.
They need vasopressors.
Yeah.
Right?
Absolutely.
So kudos to you guys on doing that. But if we can just get into the habit of saying, well, we suspect that this is a sepsis patient, but let's go through the QSOFA criteria and make sure that we document this is a positive QSOFA. I think we would really be able to take that data to the hospital and say, BSO brought in 8 patients last month to Broward Health, and they were positive QSOFA. I need your metrics to see how long it took to get that first bundle of antibiotics on board, right?
Right.
That's what you're looking at. And then if like you said, if they're taking too long, then we need to look at giving pre-hospital antibiotics, and that only happens with you guys making sure you document correctly and call these alerts correctly.
Well done. Well said.
Okay.
I love it. The last thing I would like to mention is these metrics. I don't know if you see these metrics on a monthly basis.
No.
If you look at them,
they haven't. No. Nope.
This is such an amazing thing. This agency has come a long way. With the credit to this whole team of focused on these metrics and making a difference. What we're seeing, honestly, with the trauma resuscitation whole blood is incredible. Cardiac, we're at with the Chief DiBernardo. He said we're 2 points above the state average and neurologically intact survival. So what we're doing is phenomenal. Okay, the way we're running codes. We're not exactly where we want to be, but we're getting there. We're definitely getting there.
Absolutely.
Now we're doing infectious emergencies. So I hope you can see there's a method. We're going through trauma, cardiac arrest, sepsis emergencies. We're also down the road potentially opiate emergencies. We're opiate addiction. We can help treat. But you're making a huge difference in the community, and I think that's commendable. So thank you.
Yeah.
Good job.
Well, thank you. Yeah.